According to the CDC, more than 38 million people in the U.S. have diabetes. That's nearly 12% of the U.S. population, and many are at risk of losing their vision. Dr. Christian Leal with Austin Retina Associates is here to discuss this. Welcome, first of all.
Thank you, Jenny, for having me.
Absolutely. Can you tell us how diabetes affect your eyesight?
Absolutely. Diabetes can lead to high blood sugars, and these high blood sugars eventually poison the blood vessels in the eye. And because of this, the blood vessels can get clogged up over time, and that can lead to things like bleeding in the eye, detached retina, and even really high eye pressure in the eye as well.
Not to mention blindness.
And blindness, absolutely. And people can go blind from this. And sadly, this is something that's very preventable. With our current treatments available, a quick, painless visit in the eye clinic can save you from a lifetime of vision loss.
So tell us about some of the symptoms.
Absolutely. Many times patients will have no symptoms at all, but sometimes they can have blurry vision that doesn't get better with artificial tears. They can have floaters in their vision, or they can have severe pain in their eye. And the red, painful eye is something that we need to get looked at for sure.
Just sounds like it underscores the importance of early detection.
Early detection is key, and that's why I'm so excited when I see patients who have some degree of damage, but it's reversible or treatable, because we have very effective treatments today that can keep blindness away for the vast majority of people.
Can you talk about a couple of those treatments?
Absolutely. There's laser procedures. We can do a laser that takes about 30 minutes to do if the diabetes is advanced in the eye, can save you from a lifetime of vision loss. And I tell patients, I'm so grateful you're here today. We can get this treatment for you to save you from a lifetime of blindness. Another treatment is different types of medicines that we can administer in the eye. And these are very advanced medicines. They've been around for over 20 years, and we keep making improvements in them.
Oh, good.
And they're able to keep people from losing vision as well. And they're remarkable treatments that we have. We were very fortunate that we live in the modern day to have access to these medicines.
Speaking of improvements, that can't happen without research. Is there any new research going on?
Absolutely. Here at Austin Retina and around the world, a lot of research is being done to improve our treatments. For instance, one thing that is really remarkable for me in my day-to-day are these medications. They're called intravitreal injections. They're injections that are painless, that are administered in the eye. And these medicines help to save people from going blind. And before, we'd have to get these treatments every month. And now we have treatments that can be extended to every 4 months.
Oh, that is
so
convenient.
That's really convenient and really helps give peace of mind to families and patients, where sometimes it's hard to come in. They're older patients, kind of frail, and able to come in every, 3 times a year sometimes to get treatment.
So what's the bottom line this morning for people watching?
The bottom line is, if you have diabetes, it is critical for you to get an eye exam at least once a year.
Doesn't matter if it's diabetes 1 or diabetes 2.
Diabetes 1 or 2, or if you're pregnant and have diabetes, even more critical to come see us. And you can see any local eye doctor, and if needed, we're always happy to see you at Austin Retina or with a retina specialist to evaluate your symptoms. But we're here to help keep people from going blind. It is the greatest joy in my professional life, helping save sight each and every day at work.
Sure. Just like those of us with prescription lenses, go see once a year, right?
Once a year.
Okay.
That's at a minimum, once a year.
All right. Thank you so much for coming on KVUE's Midday.